Adrenal crisis, also known as acute hypoadrenocorticism or Addison's disease, is an uncommon but serious condition in dogs characterized by a deficiency in crucial hormones produced by the adrenal glands, namely glucocorticoids and mineralocorticoids, or sometimes both. It's estimated that a significant portion, around 30%, of dogs diagnosed with hypoadrenocorticism are first identified when they are in the midst of an adrenal crisis. This acute presentation is a true veterinary emergency that demands immediate and intensive medical intervention. While there is a considerable amount of knowledge regarding how Addison's disease develops, how it manifests clinically, how to diagnose it, and how to manage it in the long term, the scientific evidence regarding the very best way to treat a dog experiencing an acute adrenal crisis has remained surprisingly limited. Traditionally, these critical cases have been managed with aggressive intravenous fluid therapy aimed at restoring blood volume and circulation, alongside the administration of fast-acting glucocorticoid medications. In the realm of veterinary medicine, two glucocorticoids, dexamethasone and prednisolone, are the ones most frequently used in such emergency situations. However, guidelines in human medicine strongly recommend hydrocortisone as the primary choice of corticosteroid for patients in adrenal crisis. There are several reasons cited for this preference in human medicine. Firstly, hydrocortisone possesses a balanced activity, providing both glucocorticoid and mineralocorticoid effects, which are both typically deficient in an adrenal crisis. Secondly, hydrocortisone has a relatively short half-life in the body. This is seen as an advantage because if a patient were mistakenly given hydrocortisone and did not actually have hypoadrenocorticism, the risk of significant long-term negative consequences would be low. Furthermore, hydrocortisone is generally considered to be relatively inexpensive, has a good shelf life, and is widely available. Dexamethasone, on the other hand, is frequently utilized in veterinary medicine, particularly in situations where the results of an adrenocorticotropic hormone, or ACTH, stimulation test, which is crucial for diagnosing Addison's disease, are not immediately available. The researchers concluded that their retrospective study adds to the growing body of evidence suggesting that hydrocortisone infusion is a safe and effective treatment for dogs presenting with acute adrenal crisis. Importantly, their findings showed that this treatment protocol was not associated with an increased risk of rapid or dangerous electrolyte or acid-base changes, did not lead to longer hospitalization times, did not necessitate more intensive monitoring, and did not result in a higher case fatality rate when compared to the more commonly used dexamethasone protocol.